today to this introduction to the Academy of Medical Educators. Really nice to meet so many of you. My name is Dr. James Fisher. I am one of the membership committee co-leads here at the Academy of Medical Educators, and I sit on the executive committee, and I'm a member of council. And I'm also an occupational health physician by background and work at the University of Surrey as a lecturer in medical education. Today we're going to be joined by Tony Carlisle, who's the Executive Director of the Academy of Medical Educators, Jodie Burnett-Wren, who's Events and Membership Manager Extraordinaire, and Amanda Payton, who is our newest member, who is the Administrative and Committee Support Team member. Is that correct, Amanda? Perfect, good, we're doing well. So we've got the whole team here ready to answer your questions. So please do write down any questions you may have and we'll go through them at the end. And so really, I hope that you can all see my screen. So what we're going to be talking about today is who the Academy of Medical Educators are. We're going to talk about the professional standards and the application process to become a member. We're not going to be talking specifically about how to become a fellow of the Academy of Medical Educators, and there is a separate series that we're running at the moment to provide some advice and guidance for people who want to become fellows. So today we will be focusing on membership. I do apologise if you can hear my dog barking outside. He's decided that 4:30 is the time that I've finished work and he should be doing something more exciting than watching me do this talk. So the Academy of Medical Educators really was formed because we recognise that medical education is a really important and vital part of clinical work. Is that I often talk about this in my own teaching, is that the work of a doctor also has to involve the work as an educator. And in the same way that we would have clinical standards for any medical specialty and for any sort of clinical guidance, is that there is a need for clear and verifiable standards in medical education. There's a need for a curriculum, for training that sets out the capabilities that are expected of clinical teachers. And there should be a recognition of the opportunities for structured and continuing professional development. So this is where the Academy of Medical Educators comes in. It was founded in 2006. We are a registered charity and we're a not-for-profit charity. We have an elected president and council. At the moment, I don't think that there's any elections coming up for council, but these are fairly regular and they can be put forward by members. This is the first organisation to offer a registrable qualification and professional accreditation for medical educators based on nationally agreed standards, and that's really important. At the moment, we have well over 1,000 members, and that includes all of those who are taught in the medical model, including doctors, dentists, vets, and physician associates. We also are mainly UK-based, with most of the team based down in Cardiff, but we also have quite a significant international presence, and that's recognising those standards as well, and that is an area that is growing. So in terms of the Academy of Medical Educators, we are this charitable organisation developed to advance medical education for the benefit of the public through having a professional standards framework and qualification systems to show that someone has reached a set standard in medical education, as you would in any other clinical specialty, but also the promotion and dissemination of current best practice in medical education. And at the moment, we're doing that through a series of webinars, and we're also doing that through our regular conferences. And I feel like I should probably plug that we have a conference on the 12th and 13th of November this year, which I think has just been announced, and more information can be found on that on the Academy's webpage. So why should I join the Academy at membership level? So this was something that I thought about 5 or 6 years ago when I applied for membership of the Academy. And I hadn't actually heard of the Academy of Medical Educators before, is that it really is limited in sort of general knowledge to those who are involved in education, marking that quality in education that person has reached. So some of the key things that people tell us about why they want to join the academy is sort of possible answers might be career progression to help you get a job, is that having that standard, that nationally and internationally recognized standard of the level that you've achieved as a medical educator can help to prove your credentials as an educator if you are applying for a job in healthcare education. It also is important for professional recognition. And I think it also recognises that medical education as a profession is a valid career choice in itself. And I think this is really key, is that it's not considering education just as a little tidbit to have on the side of your clinical job. It's recognising that there are verifiable standards, there is a knowledge base, there is an art and a skill in being a medical educator that is recognised through becoming a member. You also get some post-nominals, which is great to put some more letters after your name, and it looks really fab on an email footer. And I think that there's a number of other reasons, which are perhaps that you've completed an accredited course and you're looking for that next step because the course has been accredited by the academy. You're looking to find out ways in which you could get good CPD opportunities through our conferences or cheaper conference fees. For me, networking was one of the reasons why I became a member in the first place, is that having an accessible network of medical educators who are experts in their field is really important. And actually, thinking about the network at the Academy of Medical Educators, it's one of the most valuable things that I've found as a member for me. Having the opportunity to discuss medical education with people who are professors in their field, who have significant experience, who can offer advice and guidance on where you can go, what you could do next, what you could try, what the pitfalls they found. I think that that's incredibly valuable. And another reason is perhaps you want to see if you could get membership, see if your education credentials meet our required standards to demonstrate that you are at that level as an educator. So I've spoken quite a lot about our professional standards, and I think this is one of the things that really sets the Academy of Medical Educators apart. And I think it's really important, and I think that if you are considering a future career in medical education, irrespective of whether after today you apply for membership, which I of course hope you all do, but I think that these are a really good read. And I think that they're really important to reflect on and consider how your practice matches up to these standards, which have been considered for those who are involved in healthcare education. So the professional standards are based around 4 core values. And quite often you will see these core values for any professional identity. So promoting quality and safety of care, demonstrating professional identity and integrity, a commitment to scholarship and reflection in medical education, and demonstrating respect for others. And you will see this through your membership application, is that different facets of this will be assessed throughout your application, particularly thinking about your commitment to scholarship, recognizing that there is a big evidence base for medical education and that you have looked into it and you've engaged with that, but also reflecting both upon that material and your own personal experiences to demonstrate that you are a critically reflective teacher who can meet those core values that are so essential to us as educators. So other than the 4 core values, there are also these 5 domains of professional practice. And these wrap around the core values and they're important as well. And these are the designing and planning of learning activities, teaching and facilitating of learning. So these are typically the things that perhaps more junior educators would definitely have in their bag. So that design and planning of learning activities, but also the teaching and learning, facilitating of learning. Perhaps something that people might not have experienced as much is the assessment of learning. And this is something to consider where you might meet those standards. Educational scholarship and evidence-based practice. That's really important because, as with any clinical specialty, there is this background of knowledge. There is a deep understanding. There are underpinning principles to healthcare education, and having those in your bag are really important. And the final one is educational management and leadership. Now, this is something that perhaps some people might not have experienced, but there are different levels of these as you go through, and I'll show you those now. So if you look, for example, at domain 1, so we're thinking about that designing and planning of learning activities, is that's something that I imagine most of you on this call have undertaken. We've all organised a teaching session, perhaps for medical students, perhaps for some fellow doctors, perhaps for some fellow healthcare professionals in different specialties. And what you can see here is there are different standards within that domain. And when we're thinking about membership, we're thinking that most people will be meeting level 2 in most of these, and perhaps exceeding level 1 in some of them in order to meet that membership. So if you think about this, these are all broken down into separate sections. So within design and planning of learning activities, you have learning and teaching principles. So for example, level 1 is describing how the principle of learning and teaching are incorporated into educational developments. And that standard goes all the way through to level 4, leading the strategic application with an impact that extends beyond their own institution. So you might be thinking that someone who is a professor in medical education with significant experience and knowledge, who is taking their own findings and knowledge beyond the institution that they're working in. And this really is your grade from going from level 1 through, demonstrating where you achieve on this. So in terms of becoming an Academy of Medical Educators member, is that really looking at membership, we say that is for all of those who are professionally involved in medical education at any stage in their career. Applicants for membership must demonstrate a commitment to medical education. Now, I know we're not necessarily talking about fellowship today, but one of the questions that has come up in previous webinars that we've done is, can you jump straight to fellowship, for example, if you meet those standards? And the answer is absolutely yes. Is it for those who are established in and have made contributions to medical education, and thus might be way into a career in medical education, and they must demonstrate a broad contribution to or significant achievements in medical education? And when we were thinking about that last side with the descriptors of 1 to 4, is that we would be expecting those in fellowship exceeding level 2 in most of the domains. And I think that shows that progression as an educator, developing really from an early career educator to what you might consider the SHO of the educator world, the registrar, and ultimately the consultant at the end of it. There is also principal fellowship, but we're not going to discuss that today. So why membership? Why EMA-CADMed? So this is really a demonstration that you've met the nationally agreed standard for medical education. And I think this is really important because we are the standard setting body for healthcare education. And I think that's essential to us as a profession to demonstrate that we are meeting the standards that have been set out, to show that there is an understanding of what you have achieved and what level you're at in the education world. People who are applying for membership will have a commitment to CPD. Now, often we do think about CPD as being our clinical CPD, but also reflective CPD, and thinking about the continuing professional development of seeing conferences and the webinars that we run, for example, or your own reading, and making sure you're attending conferences and courses to keep your skills up to date, recognizing that the CPD for an educator is as important as it is for any other clinician. Is that some people think that perhaps a PG cert is all you need, and then you never need to think about educational theory or any of that background ever again. But it's really important, as with every specialty, to develop your understanding as you continue to go and to keep on building on that knowledge and to demonstrate your understanding and continued understanding of what it involves to be in that specialty. And that really is a reflection of your professional practice as a medical educator. And this is also important, is that every application goes through our team who read the applications, provide feedback, and it's been rigorously reviewed by your peers, and we'll talk about how that happens in a moment, but also by your education peers who may not have met you either. And I think it's really important, this point here about demonstrating reflection on your scholarly practice as a medical educator, because it's exactly the same as clinical work, is that we have to make sure that we're reflecting on what we've done, why we're approaching it in a certain way, how we might do things differently, how we might progress our teaching to become better for the sake of providing better care through our students or people that we are educating. So the application process, this is slightly changing. I don't know if there's any students here who might be considering student membership, but this will be changing and we'll be communicating that out relatively soon. But basically, for all applications, we expect a 500-word reflective statement on the professional values. Now, typically to membership, there are 2 routes, although the accredited course route is slightly split now. So let's just start by talking about membership by recognition. So you may have seen the website, and this will guide you through the application. And as part of this, we expect a 500-word reflective statement. And the key word there is reflection, and I'll talk about that on the next slide. But a key thing is reflective statement on your professional values. And those professional values that we've talked about, which you can find on the Academy of Medical Educators Professional Standards page. And I think Jodie has put a link handily in the chat for you guys to have a look at. It's also important to have a reference from a fellow medical educator, perhaps someone who has watched one of your sessions or who can give you a nice reference. And also for membership, we expect someone to have peer reviewed your teaching. Now, sometimes it's nice to include that reflection that you've done on your peer-reviewed teaching as part of your reflective statement on your professional values, really putting theory into practice with your reflection. So a 500-word reflective statement, a reference from a fellow medical educator, and a peer review of your teaching with a 250-word reflection on that feedback. And that's quite valuable, and that's highlighting that you're able to consider your teaching, what you would do differently, how it went, and really thinking about the process of reflection within medical education. The other thing is evidence of CPD in medical education within the last 2 years, and that might be your PG cert, as if you've spent the last 6 months reading everything from Moon to some stuff about reflection and Shern Swamp, is that actually you can demonstrate that CPD quite simply through that. But also you might want to attend some of our conferences or some of our webinars that we run to really cement that knowledge and that continuing professional development. So that is your application through membership, is that gets applied on the portal, and that goes through to our assessor team. That doesn't come through to us as the membership team. I think that's important to stress, is that I won't be assessing your membership applications. Those go through a separate committee, and they will aim to provide you with feedback regardless of whether your application is successful. The other routes in are by our accreditation and our accreditation plus schemes. So you can see this on the website, and I don't know if one of the team could pop that link into the website, but there are courses which are accredited, and the accredited courses don't need to do the full application, but they do need to still complete the 500-word reflective statement on professional values. Now, one of the newer things that we have is the Accreditation Plus scheme. That is a scheme where they have been through that the program has been through an assessment by the Academy of Medical Educators team, and by completing that, you just need to highlight to us in the reflective box on the application page that you've completed this course, which is under Accreditation Plus, and that will immediately put you through the membership recognizing that you have undertaken a course which the Academy of Medical Education recognizes as meeting those standards. So I think one of the things that is really great about this application, in a similar way to those of you who may have sat membership exams, is that actually there is some use in going through this process for your understanding of the group that you're about to be a part of, but also understanding your own practice. And I think this reflective piece can be really valuable to you as an educator in your professional development. So when you're thinking about your 500 word reflective piece, you might want to think about what happened. What were you trying to achieve? What happened because of what I did? What did I learn from that situation? And could I have dealt with that situation better? Some people might find different ways of reflecting helpful. I think some of these questions are useful in sort of really putting together your application. Some of you might find Brookfield's lenses to be particularly useful, looking at your situation and what you've undertaken in different ways. Looking at it through different lenses from different people and thinking about how you might challenge or change your perspective on your teaching practice. But it's really important that we see evidence of reflection within these reflective essays. Is that sometimes, having discussed with the team in the past, is that sometimes some of these essays can be descriptive. And that doesn't tell us about your own thoughts or your considerations or how you've reflected upon the values and the importance of those values as an educator. And what we're looking for is that key skill of being able to reflect on your experiences and how that's going to inform your practice going forwards, because that's absolutely essential, and that is part of the professional standards that I highlighted at the beginning. So basically, is that if any of you are looking to become members in the near future, is that there is the email address info@medicaleducators.org, and I'm sure the team would be happy to provide you with any further advice. The website is really handy, is that we are hoping to update the website at some point in the near future, but at the moment it does contain the professional standards, which are an excellent read. Is that it has some guidance on applying for membership. It has some guidance on accreditation and accreditation plus courses, if you're not sure which one yours really meets on that list. So go and have a look at that. And if there are any questions, is that you can email the team and they will be happy to provide you with any further answers.